Well, greetings again, everyone. It's a pleasure again to have this second presentation at the CVMA. Again, it's within the ruminant conformation section. And in this presentation, we'll be discussing some of the conformational characteristics of the teat and udder with specific application to the huge increase that we're seeing in robotic milking systems. I'm starting with the same slide that I did in the other presentation, just to put in perspective the large increase in milk production that we've seen in the last 50 years. And I think that the thing that's important here is just the increased capacity that's necessary in the udder, and we'll look at that support structure and the suspensory ligaments in the udder in just a moment. When we think about how udder conformation has developed over the last probably 100 years, almost 100 years that we've had type classification, certainly we haven't had the type of udders that we have today back in those days. And so I think some of the images here characterize the type of udders that we started out with in the early 1900s. And then as we selected for more and more milk production, we ended up with udders like we have on the right here, where we've got cows that are capable of large amounts of milk production, but the suspensory apparatus in the udder was just not sufficient to hold the udder up above the hock and in the proper position so that it could be easily milked and avoid injury. So we had certainly a progression. I know that the cow on the left is a cow that was a grand champion in, I believe it was 1905. And the cow on the right was one that was an All-Canadian in the 1930s. So I think you can see already the progress that was being made, especially in the suspensory apparatus of the udder. Probably still a big part of the milking of both of these cows would have been hand milking. And so I think as we've moved to mechanized milking, we've seen also a huge change in udder conformation. This is getting more to the modern day udder structure, where we've got udders that are held high above the hock, and they gain their capacity by width and length and not by depth. I think that this is certainly a very good example of the type of udders that we have developed now. Udders that can support 150 pounds a day milk production and even much more than that, and can still remain with this good, well-balanced conformation that's easy to milk, and particularly for robotic milkers, that the sensors can find the teats easily and attach the units. I showed this classification slide in the feet and leg section. And you can see that the highest emphasis on the scorecard for classification of udder conformation is the Mammary System. And that includes not only the attachments of the udder, the balance of the udder, but the teat size and the teat placement. So we have many components within that mammary section, and we'll look at each of those here in just a moment. I want to start out, though, first by just reviewing the attachment, the suspensory attachment of the udder. And I think I've learned a great deal about this from an anatomy researcher from Estonia, Dr. Zhalakis, and I had the opportunity to meet him in person. A wonderful person, and it's unfortunate that a lot of his work didn't get translated into English because he really was a pioneer in identifying the attachment of the suspensory ligaments. And so if we look at this udder, we can see that about 40% of the udder is attached to the base of the pelvis, and about 60% of the udder is attached to the body wall. Remember that the body wall, though, is still attached to the pelvis by the prepubic tendon, so that pelvis really has a huge role in the whole support apparatus of the udder. If we look at the pelvic structure of bovines back 200 or 300 years, we see the early ones at the top here, and we can see that there's been a large transformation in that pelvis, and that transformation has been brought about by continued selection for higher milk production. And with higher milk production, we required a longer pelvis for a longer and more secure attachment. And the development of this crest on the underside of the pubic symphysis, and that in effect is where the suspensory ligaments that attach the pelvic part of the udder do attach to the pelvis. We can see that crest of the lower part of the pelvis here. And Dr. Zhalakis has actually identified a separate ossification center within that pelvis. So I think that's probably one of the reasons why we see that such a change in the development of that over the years. So again, we've represented that attachment by the red lines here. And I think it's useful to take cross sections through B, C, and D here and look at what those cross sections look like. If we look at a cross section here through B, we can see that this is a section where the entire udder, and this is the foreudder, is attached to the body wall. And we have the lateral suspensory ligament that comes around the outside, one on each side. The medial suspensory ligament comes down the center, separates the udder in half, and that medial suspensory ligament does not go to the bottom of the udder. It branches out into the udder parenchyma up above the floor of the udder. We see a situation here in C, which represents the transition from the attachment to the body wall and the attachment to the pelvis. And you can see here now that at least the medial suspensory ligament is coming up and attaching to the base of the pelvis. When we get to the rear udder here, we see that both the lateral and the medial suspensory ligaments go up and attach to the base of the pelvis. So if we do a dissection of that rear udder, and first of all, even just looking at the rear udder, we can see those medial suspensory ligaments right here as they're passing up and attaching to the base of the pelvis. In looking at the anatomy of dairy cows compared to beef cows, we notice that the dairy cows are very lean in their thighs, and that's necessary for that udder to assume a position much more caudal in the pelvis. And again, it needs to get its capacity from width and length and not from depth. So if we look at the dissection further, with the skin removed here, we've got some connective tissue that attaches up to the perineal area here. But once that has been removed, we can actually see those suspensory ligaments. We see the medial suspensory ligaments here, and the supramammary lymph node lies right between the lateral and the medial suspensory ligaments. Before we go to any further dissection there, I wanted to use an animated diagram here just to demonstrate this medial suspensory ligament and the importance of it, and the importance of the fact that it does not pass right down to the floor of the udder. And it's the traction on that medial suspensory ligament, both on the left and the right side, up to the base of the pelvis, that creates the cleft between the halves of the udder. And that cleft is so important for these teats to hang in a plumb configuration and allow proper milking. So here we've got a dissected udder then. We've got the lateral suspensory ligament shown in green, and the medial suspensory ligament on each side shown in purple. And if we separate the medial suspensory ligament on each side, we can pass a hand right through the center of the udder, really without contacting any major vessels. Then at the top of the rear udder, we can identify the lateral and the medial suspensory ligament on the left side, with the supramammary lymph node in between on that side, and the same lateral and medial on the right side. It's useful, I think, to pass a scalpel through that lateral suspensory ligament just to appreciate how thin that tissue is, and yet how strong it has to be to hold the udder up, because it's really only the lateral and medial suspensory ligaments on each side that support that udder. Once the lateral suspensory ligament is removed, we can see the external pudendal vessel bringing blood supply and taking venous blood back from the udder. When we do the dissection, we continue on. The lateral suspensory ligament has been cut here. Now we're cutting the medial suspensory ligament. And once that medial suspensory ligament is cut, you'll see that that whole half of the udder will fall away. So here we've got the medial suspensory ligament on the left side that's continuous with the medial suspensory on the right side. And so we've got an udder that's just being held up by the medial and lateral suspensory ligament on the left side. When the udder is removed, notice that the floor of the udder is very flat. And that's because there's no longer traction on the medial suspensory ligaments, and nothing to create that cleft between the halves of the udder. When we separate the halves of the udder, we can identify the medial suspensory ligaments on each side, and you can see they don't go down to the floor of the udder, but they fan out into the parenchyma of that udder tissue. And if we show this animation here, you can see this demonstrates a very weak median suspensory ligament where the floor of the udder becomes convex and the teat strut out to the side as compared to the very nice, strong, and ideal median suspensory ligament where we see that defined cleft in between the halves of the udder all the way along the floor of the udder, and it keeps these teats hanging plumb or perpendicular so that the milk will drain properly from the lactiferous ducts down into the gland cistern and ultimately the teat cistern. When udders are classified, and this really is the basis of the whole selection process that allows us to use selective breeding to improve the conformation of the udder. The classification system for all of the conformation traits in Canada is a 1 to 9 linear score. And so if we look at one of the categories which is scored, which is udder depth, we look at the undesirable situation where we've got a very deep udder that's well below the hock, an acceptable udder for an older cow where the udder is down to the level of the hock, and then a very desirable udder that, especially in a younger animal, that is held high up above the hock. We mentioned the importance of that medial suspensory ligament for creating the desirable cleft between the halves of the udder. This is a very undesirable situation where you've got either a weak or a ruptured medial suspensory ligament, and it's almost impossible to milk these cows because the teats strut out to the outside. A lot of the glandular tissue comes down into this portion of the udder that bulges out, and totally unacceptable. And so we always select and score cows for the definition in the cleavage between the halves of the udder, and that's the depth of that cleft is representative of the strength of the medial suspensory ligament. This is a cow here that's an example of an extremely strong median suspensory ligament. You can see also the width that we get with this udder. So tremendous capacity in this udder, but still it's held high up above the hock. And when we think about, you know, the type of udders that are going to be easily milked in a robotic milking system, you know, certainly this is a classic example of some of the characteristics that we need to achieve, and the importance of being able to produce udders like this in robotic milking systems. That importance has never been greater. We've got just a summary of all of the different types of traits that are scored in the classification system. The udder itself on the left side here, and on the right, it's involving teat placement as well. So you can see that there's the levelness of the floor of the udder becomes particularly important. And we'll look at that in relation to robotic milking in just a moment. Certainly the udder depth is important. A robotic milker simply cannot attach the units if we have an udder that is too deep. Incidentally, if we have an extremely tall, long-legged cow with the udder too high, the robotic milker has difficulty attaching the udder to those cows as well. So we're always looking for selecting cows of intermediate stature. Udder texture, I'll come back to and discuss in just a moment. We talked already about the strength of the median suspensory ligament, and we'll look at a video here in just a moment to evaluate or just to appreciate the difference between an udder like the one we have on the right, where the lateral suspensory ligament attaches strongly to the body wall in the foreudder, versus one that is broken away. And these ones that are broken away lose a lot of the support of the udder. And so those are the types of udders that tend to sink and become the very low dependent udders. When we look at teat placement, we're always looking for teats that are placed squarely under the udder. And you'd be surprised how fussy robotic operators are in selecting sires for their cows on the basis of teat placement, because we know that it's the easiest for that robotic milker to attach teats or attach the units if the teats are squarely on the corners of the udder. So we identify teats that this is front teat placement that's too wide. This is ideal, and this is where they're too narrow. We also have an evaluation for rear udder attachment, which we showed you just a moment ago, where we're looking for attachment that is both high up to the base of the pelvis as well as lots of width. And to have the width, it facilitates these nice clean thighs that's so characteristic of the really refined type of dairy animal that we have these days. Rear teat placement is also a significant factor. And you can see again here, this is a situation where the teats are very close together. Think about how the robotic milker ever is going to be able to attach the units to teats like that. Also undesirable if they're too wide. And so we want them in that intermediate level. One of the other things that has become a real priority in the breeding programs of late is the teat length. We have inadvertently selected for cows with very short teats, and those are very problematic, and we're going to come back and look at those and identify why they're problematic, especially with some of the robotic milking systems. This slide here just shows you I guess I would say good, better, and best when we're looking for rear udder height and width. You can see this is quite a narrow rear udder, quite a low rear udder. This one's substantially better, and this one's really outstanding. And these are going to be the type of udders that are going to be able to produce huge amounts of milk, and these cows will last long, multiple lactations, and also be able to be milked very freely and very efficiently in the robotic system. When we look at the attachment of the udder to the body wall in front, we'll come back to this, to the blood supply to the udder in just a moment, but I think it's useful when we look at that udder to do a dissection and think about, how this, the lateral suspensory ligament of the udder blends in and attaches to the body wall. And so the conformation of that body wall has an impact on the conformation of the foreudder of the cow. If it's a weak slack or a weak dependent body wall, then we may well get a dropped foreudder, something that looks similar to this. But in any event, it's the attachment of that suspensory ligament to the body wall, and then ultimately up to the prepubic tendon that provides the strength to the foreudder. Just a couple of slides here that shows that there's the lateral suspensory ligament where it blends into the body wall. And you can see beneath that is the superficial caudal epigastric vein. And we'll come back to that in just a moment when we talk about the circulation to the udder. I talked about the importance of having an udder floor that is level. And you can see, this is particularly for robotic milking, you can see with this udder floor here, this is what we call a reverse tilt, where the forequarters are lower than the hindquarters. And remember that the laser cameras that identify the teats for unit attachments are in the front. And so it's very difficult for that camera to see these hind teats. And so severe reverse tilts are cows that just end up getting culled from robotic systems because they can't be milked efficiently. If we have an udder that has a relatively level floor, then the attachment becomes very easy. So we've got several types here. This is another one with a really severe reverse tilt. And one down at the bottom here with a very nice level floor to the udder. And I think when we look at the type of or the emphasis that producers with robotic systems put into their selection criteria for selecting bulls, it's never been a greater priority than their selection for levelness of udder floor, teat placement, teat size, you know, all of those parameters that become so important. When this is an outstanding udder on this cow, you can see, well, it was well above the hock. The same with this one. If you look at the great cleft that separates the halves of this udder, but inadvertently, I think in the population, we've selected for teat placement that is too close together. I'll come back to that image in just a moment. But in looking at this is the udder in a young heifer. And I think you can already see that this, the cleft is not nearly as clearly defined in this heifer. These teats already starting to strut to the outside. And the same thing with the front teats. So that's an indication of a weakness of the suspensory ligament. Probably this is a one lactation cow. So that's the importance of those good udder suspensory ligaments creating that cleft. Here's an example of what we commonly see in the breed today. We have selected very strongly for strong medial suspensory ligaments. And in doing so, we probably have inadvertently selected for teat placement that is too far to the inside. So you can see that the most dependent part of these quarters is right here. And this is where the teat should be, because as the milk drains down into the gland cistern and then into the teat cistern, it needs to drain from the most dependent part. So there's always going to be some milk that collects in this part of the udder that will never be properly milked out through the teat. And also think about how difficult it is for the robotic unit to attach the units to teats like this. Okay, so that's the teat placement. When we are looking also at desirability of teats, the teat length becomes absolutely critical. There's no doubt that in the development of udders back through the 30s and 40s, when hand milking was the way of milking, cows had longer teats, and that was desirable for hand milking. When we get cows these days with really short teats like this, it would be impossible to milk these by hand unless you were really good with your fingers and your thumb, because through that selection process, we have inadvertently selected for teats that are too short. And we'll look at just a moment in the function of the milking machine at how disastrous that is for teat and health. These are, we see occasionally teats like this that are much too long. And when we think about when these teats are in the unit and making contact with the inflation, teats that are too long are problematic, as well as teats that are too short. And we'll look at that mechanism so that that statement makes some sense here in just a moment. This is another udder that has teats that are way too short. So this cow has a multitude of problems. She has a reverse tilt. If you look and see, there's her front quarters. Her hind quarters are high. These teats are too far to the inside. They're not on the most dependent part of the quarter. And in addition to that, they're too short. And we'll see that, you know, when these teats are being milked, they go through a milk phase and a massage phase in the milker, and it's impossible to get a proper massage phase on a teat that's that short. We've got an udder here where we've got very nice teat placement right in the center of the quarters. Teats hang nice and plumb, but they're pretty short. It'll be the teat length, if anything, that would be problematic with this udder. Certainly no problem with the robot finding these teats for attachment. And this teat has, or this udder rather, has good width, and it's also got good strength of the median suspensory ligament, indicated by that nice deep cleft between the halves of the udder. Okay, so let's look at the milking machine and think about what happens and why we need to be concerned about teat length. So in the milking unit, maybe I've got a better, nope, I'll go back to this slide, whoops. So it's really made up of two systems. We have the milk system, which is this is the short milk tube and up into the inflation. There's a rubber inflation here, and there's a separate chamber between usually the stainless steel shell and the rubber inflation. And we have alternating vacuum that is in the shell around the inflation, and that's what continually opens and closes that inflation. When the inflation is open, as it is here, the vacuum is, the teat end is exposed to the vacuum. And that's when it is in milk phase. And the milk then will be sucked out of the teat and down the short milk tube into the claw. When that teat is in rest phase, or when that unit is in rest phase, there's no vacuum in between the inflation and the shell, and the vacuum that's in the milk tube will collapse that. And as it collapses that, it squeezes the inflation on the end of the teat, and that squeezes any of the congested blood supply that's trapped in the end of the teat, massages it, allows the milk to come from the gland cistern into the teat cistern for the next milk phase. I think when we look at robotic milking, and this happens to be a DeLaval, and this is a pre-milking prep that this robot is putting the cow through. And we always knew from manual milking that we needed a 60 to 90 second time frame that from the stimulus that the prep served on those teats to stimulate an oxytocin release and have a good milk letdown. And we know that probably the most damaging event to the teats is if we have the machine attached and start milking before we have a good milk letdown and before those teats are properly engorged with milk. So you notice that that prep time probably took a minute and 20 or even a little bit more. And now the units are being attached in the same order that each teat was being prepped. So that's the deal valve system. The prep system, I think a very acceptable prep system. Notice that it attaches each unit separately. When we look at the Lely system, a bit different. It uses a series of rotating brushes to clean and prep each teat, and at the same time stimulating those teats for a milk letdown. In the original Lely models, the milk prep time was very short. And so what happened is that by the time the units were being attached, we didn't have a very good milk letdown, and it was particularly traumatic on those teats until we got the oxytocin release and the milk letdown. Though the new A5s that Lely has come out with now have a much longer prep time, and so there's a good milk letdown before the milkers are attached. And I know that in talking to some of our breeders, they share the view that when they upgraded from an A3 to an A5, where the prep time was 2 or 3 times longer, their actual milking time was less. And that milking time was less simply because they had a good milk letdown, and immediately when the units go on, the milk flow in each quarter was up at a very nice high level. For sure, we have instrumentation to identify what the flow rate is like. And so this would be a nice flow rate that we could record in a lactocorder. The flow rate increases, stays high, the cow milks out, and then very quickly drops off and the machine detaches. If we have a bimodal situation like we have in this graph, we know that we didn't have a proper milk letdown in that quarter. And you can see that it was well over a minute before we ended up getting the good milk letdown and the good flow rate. And so the unit was on that udder for substantially longer time. And we have to think about the trauma that was applied to the teat in that early part of the milking when there was a poor milk letdown. This is a diagrammatic representation of what happens with that when the inflation opens and closes. So that's milk phase. This is rest phase. And you can see in that particular video, the teat was an appropriate length. And so when the inflation closed, it provided the adequate massage to the end of the teat. One thing that we need to be aware of with robotic milking systems is that this mouthpiece chamber in many of the robotic units is a very deep unit, and there should be very little vacuum or a very low vacuum at the mouthpiece, much lower than there is exposed to the teat end. So it allows this teat to fill properly. And then when this opens, it allows it to be milked properly. If we look at, excuse me, if we look at this as an example, if we look at image A here, we have a situation where we've got a teat that is long enough and a barrel that is narrow enough that the teat completely fills that. And so because it has a good fit, then there's very little vacuum in the mouthpiece here, as it should be. And so this should allow for very good, efficient milking. If we have a mouthpiece, a combination of a mouthpiece that's very deep like this, and we have a relatively short teat, then there's not a perfect seal that forms between the teat and the inflation, and we get an elevated vacuum up here that will create these very traumatic rings at the base of the teat. If we look at C image here, we have a situation where the teat is long enough and the mouthpiece is narrow enough for good apposition, but the barrel of this inflation is too big for the circumference of this teat, and we get leakage of vacuum from the milk tube here up into the mouthpiece. And so we end up with the same sort of situation that we'd have if we have a teat that is too short. So if we have a lot of vacuum in the mouthpiece, we get these very pronounced and traumatic rings at the base of the teat. And if we end up with, well, sorry, this is just an example of some of the monitoring devices that can be used where the vacuum is being monitored in the short milk tube, and it's also being monitored in the mouthpiece. So it's a very good way of evaluating the stability and the proper, I guess, fitting between the mouthpiece and the size of the teats that are characteristic to the herd that's being milked. This is another example of that. So when we've got lots of milk in the udder, lots of pressure of milk there, we need to have, we've got good massage of the teat. This is a desirable teat. And once that teat becomes milked out, it's going to collapse. And then, we need to get the machine off fairly readily. When we're looking at evaluating that previous setup where I showed that they were evaluating the vacuum both in the short milk tube and in the neck or in the top of the inflation. This is a desirable type situation where you've got a milking vacuum at the teat end that is pretty consistent. You've got a very low vacuum in the mouth of the inflation until that teat collapses at the end of milking, and then the milk or the vacuum will rise in that the mouthpiece. If we look at undesirable type where we might have a teat that is too short or a mouthpiece that's too deep or inflation that's too large, we see that you get the vacuum that's in that mouthpiece that rises much too quickly before the cow is milked out, and certainly damaging to that teat. So I drew this diagram here to just demonstrate what happens if we have this is a regular inflation, and this would be the desirable teat length to be in a position about here. This would be a teat that is too short, not making a complete separation between the mouthpiece and the milk tube. And we can also have a teat that is too long, that it extends beyond the collapse point of the inflation. So if we look at the next step here, where that inflation collapses in the rest phase, we can see that we get nice massage of this teat that's the proper length. We don't get good massage of the teat that's too long, and we never get massage of this teat that is too short. So teats that are too short are problematic. There's no doubt that with robotic milking, our milkers, the mouthpiece of those most of the units is quite a bit deeper than with traditional milking systems. And so if we don't get proper massage of those teat ends, we end up getting teat end damage like this that results in mastitis. It results in pain at milking time, so cows don't let their milk down properly. And so an evaluation of teat ends becomes a very important part of herd health work. It should be with all sorts of milking systems, but I think that we're gradually learning more and more about the robotic milking systems, and learning, some of the pitfalls that we need to be observant of, so that we can prevent teat ends getting into this sort of shape. So again, this is probably a better example of the difference between the milk and the rest phase. This is the milk phase here, where there's vacuum in this pulling the liner apart, and the teat end exposed to the vacuum. This is a situation here where it's in the massage phase. Incidentally, I think it's important to recognize that we can get those damaged teat ends both when we have vacuum that is too high and when we have vacuum that is too low. So think about, if the vacuum is too high during the milk phase, it'll be very traumatic on that teat end. If the vacuum is too low, so in other words, if there's not enough vacuum in this milk tube to overcome the resistance of the inflation, and that inflation never completely closes, that means that the teat end is always going to be exposed to some vacuum. And so having a stable milking vacuum, whether it's a robotic milker or a traditional milking system, is critically important. And then this is just a diagram of graphing out the pulsator function from when the inflation is just opening, fully open in milk phase, starting to close, and fully closed in rest phase. And we find most of the milk to rest ratios in most of our systems around 65-35 or 60-40. I wanted to finish up just with a bit of a discussion on udder quality. And when we talk about udder quality, we mean that, there shouldn't be any scar tissue or edema or anything like that in the udder that's obstructing the clear flow of milk down through the lactiferous ducts into the gland cistern and down into the teat canal. And so if we have really nice placed teats like we have here, it's extremely easy for the milk to flow down into the gland cistern and then into the teat. When you see an udder like this, you know that that's an udder that is a very good quality udder. And when those are milked out, there's not very much volume of udder there at all. We know when a cow calves, especially a first calf heifer, that there is an anastomosis of what becomes the milk vein. So there's an anastomosis of the cranial and caudal superficial epigastric veins. And until that anastomosis is complete, because of the huge increase in blood flow that comes to the udder edema is a common and a normal occurrence. Also, we see this usually bulge of edema in front of the udder. This will be about the area where those, the superficial or the cranial and caudal superficial epigastrics will anastomose. And then the main venous flow back from the udder will come via those vessels. So this is the anastomosis area. That's why in the virgin heifer, the circulation to the developing udder basically comes via the external and internal pudendal, and the drainage comes via the same route into the caudal vena cava. Once this system develops of the epigastric, the bulk of the venous drainage from that udder will come via the what becomes the milk vein, then the internal thoracic and into the anterior vena cava. So that's how the cow has really adapted the circulation to handle that huge amount of blood flow, 500 liters of blood for every liter of milk that's produced. So a huge volume of blood going through that udder, and not surprising that we have, significant edema in some of these fresh heifers. Edema that must be controlled because it's with a large amount of edema like this that adds weight to the udder. And it also, when we see this pitting edema, we know that that's putting stress and pressure on those, both the lateral and the medial suspensory ligaments. And if we're going to protect the integrity of those ligaments, cows with this amount of edema, while they're waiting for that, the epigastric vessels to anastomose, they need some help with diuretics. This is the complete vascular system in a mature cow where that the epigastric vessel has completely been constructed. And that's why we see less edema in multiparous cows versus first calf heifers. So I think it's amazing how the industry adapts to the needs for good udder conformation. And we see now that CEMEX has developed a marketing strategy for robot-ready sires. So they have a group of sires that have mastitis resistance, good mobility, good teat placement, teat length, udder depth, all of those sorts of things that make them good robotic cows. And so it's amazing to see where the emphasis goes when we see such a change in milking technique that we do in transitioning from parlor milking to robotic milking. And so just a few of the references that I used to put this presentation together, and I'm certainly happy to entertain any questions if there's time for some questions. Thanks very much.